Don't touch your face yet. Before you wash it, before you put on a single drop of cream this morning, look in the mirror and ask yourself one question. Why does your face look more tired at 55 than it did at 35, even on nights when you slept just fine? It is not just aging. It is not just water weight. There is a hidden plumbing system running through your neck right now, and if it gets backed up, your whole face pays the price. Stay with me, because the fix takes 90 seconds and most people have never been shown it. I want to talk to you today about something most people walk around with for years and never think about twice. Puffiness. That heavy, soft, slightly swollen look around the jaw, under the chin, sometimes creeping up toward the cheeks. Most people blame salt. Some blame sleep. Some just sigh and call it aging and move on. But there is a structure in your neck that has a much bigger say in how your face looks than salt ever will, and almost nobody talks about it. Think about someone you know. Maybe it is your sister or your neighbor or even you. Someone who eats reasonably well, drinks their water, sleeps a decent amount, and still wakes up looking like they had a rough night even when they did not. They poke at the underside of their jaw in the mirror and wonder when that softness arrived. It did not arrive overnight. It built up slowly, the same way a drain gets a little slower every year until one day it barely works at all. Here is the part that surprises people. Your face does not exist on its own. It is connected to your neck the same way the upstairs rooms in a house are connected to the pipes running through the walls. If those pipes get slow, it does not matter how nice the upstairs looks. Eventually, the slowdown shows. So, let's talk about what is actually happening, because once you understand it, the fix makes complete sense. Your body has a drainage network running just under your skin called the lymphatic system. Think of it less like your bloodstream and more like the gutters on a house. Your blood is the busy highway, constantly moving, pumped hard by your heart. Your lymphatic system is quieter. It does not have a pump. It relies on movement, on muscle contraction, on you actually moving your body to push fluid along. It collects waste, excess fluid, and debris from your tissues and carries it toward a cluster of drainage points in your neck, right around the area where your jaw meets your collarbone. When that drainage point is clear and flowing, fluid moves through efficiently. Your face looks defined. Your jawline looks like a jawline. But when that area gets congested even slightly, fluid backs up the same way water backs up in a clogged sink. And where does it show first? Right in your face, because the tissue there is thin, soft, and quick to reveal swelling. This is not something your regular doctor is likely to mention at a checkup, not because they are hiding anything, but because it sits in a strange middle ground. It is not a disease. It is not an emergency. It is just a quietly neglected system that nobody trained you to pay attention to. Here is your first real revelation, and it is one most people never hear. The lymphatic vessels in your neck can become sluggish simply from a lifetime of poor posture and a lack of targeted movement. Picture a garden hose that has been kinked in the same spot for years. Even after you straighten it out, the water does not immediately rush through like new. It takes a little encouragement. Researchers studying lymphatic drainage techniques have found that gentle, directed manual stimulation can meaningfully increase lymphatic flow in the treated area, helping move stagnant fluid back into general circulation. This is not exotic. Physical therapists have used manual lymphatic drainage for decades, originally to help patients recovering from surgery or dealing with lymphedema. What's exciting is that the same basic principle applies to everyday facial puffiness, just in a gentler, smaller scale way. The practical takeaway is simple. You do not need to diagnose yourself with anything. You just need to learn how to encourage that drainage point in your neck to do its job a little better. Here is your second revelation, and this one tends to surprise people the most. Tension in your neck and shoulders is not separate from facial puffiness. It is often a direct cause of it. When the muscles around your neck stay tight for years, whether from desk work, driving, or just the way you carry stress in your body, they can physically compress the soft tissue around your lymphatic pathways. Picture a busy highway where someone parks a truck halfway across 2 lanes. Traffic does not stop completely, but it slows to a crawl, and everything backs up behind it. Chronic neck tension acts like that truck. It does not block drainage entirely, but it slows it enough that fluid lingers in your face longer than it should. Here is something to think about before you finish your morning coffee. The third revelation is about timing, and this is the one that changes how people approach the whole topic. Puffiness is almost always worse in the morning, and there is a simple, almost mechanical reason why. When you lie flat for 7 or 8 hours, gravity is no longer pulling fluid downward and out of your face the way it does when you are upright. Fluid that would normally drain toward your neck and collarbone during the day quietly pools in your face overnight instead. This is why a quick session of manual drainage first thing in the morning tends to be far more effective than doing it at night. You are not fighting gravity, you are working with it. Now, before we get into exactly how to do this technique, I want to pause for 1 second, because what comes next is genuinely the part people tell me changes their morning routine the most. If you have ever wondered why some people seem to look more awake and defined within minutes of waking up, while others look swollen for hours, the answer is coming up, and it is almost embarrassingly simple once you see it. If you are finding this useful so far, it genuinely helps to hit subscribe because we cover topics like this every week, the kind of small daily habits that quietly make a real difference. Now let's get back to your neck. Here is the fourth revelation, and it ties everything together. The order in which you drain matters. Most people who try facial massage make the same mistake. They start by rubbing their cheeks or pressing on puffy areas directly, hoping to push the swelling away. But if the drainage point in your neck is still congested, you are pushing fluid toward a clogged exit. It is like trying to empty a sink by splashing water toward a drain that is still blocked. Nothing improves until you clear the exit first. This is why the correct technique always starts at the base of your neck and works upward and outward, never the other way around. Clear the drain first. Then, let gravity and gentle pressure do the rest. Many people who try this notice a visible difference in puffiness within the first week of doing it consistently each morning, often describing their jawline as looking more defined and their under-eye area looking less heavy. Everyone's body responds a little differently, and consistency matters more than intensity. But the principle behind why it works is well established in how the lymphatic system functions. Let's walk through exactly how to do it, because the technique itself takes less time than brushing your teeth. Start by placing 2 or 3 fingers gently at the base of your neck, right where your neck meets your collarbone on both sides. Press lightly, nothing aggressive, and hold for about 3 seconds. This is your drainage point, your exit valve. You are simply letting it know it is time to open up. From there, move your fingers up the sides of your neck in slow, gentle strokes, always moving downward toward that same collarbone area, never upward toward your jaw. Repeat this 5 or 6 times on each side. You are encouraging fluid to move in the direction it is supposed to go. Next, move to your jawline. Starting just under your ear, use light pressure and stroke downward along your jaw and down your neck toward that collarbone point again. 5 or 6 slow strokes on each side. You will likely feel your skin warm slightly. That is normal. That is circulation responding. Finally, move to the puffiest areas, often just under the eyes or along the cheeks. Use your fingertips. Very light pressure, almost like you are smoothing a tablecloth rather than kneading dough, and guide that fluid down toward the jaw, then down the neck, then to that collarbone drainage point, one final time. The entire sequence takes about 90 seconds. Do it every morning, ideally right after you wash your face, while your skin still has a little moisture for your fingers to glide on. I want to be clear about something important. This technique supports your body's natural drainage process. It is not a replacement for seeing your doctor if you notice sudden or one-sided swelling or puffiness that comes with pain, because those situations deserve a real medical evaluation, not a home routine. This is about supporting an everyday process your body already runs, not diagnosing or treating any underlying condition. What makes this approach work so well is that you are not fighting your body. You are not trying to force change through pressure or pain. You are simply removing the kink in the hose and letting your body do what it already knows how to do. People often ask how long it takes to see a difference, and the honest answer is that it varies. But many people notice their morning puffiness easing within days, and a more consistent, defined look building over a few weeks of daily practice. The skin under your eyes and along your jaw tends to respond first, simply because it is thinner and quicker to show change in either direction. There is one more thing worth mentioning, because it ties directly into why this matters beyond just appearance. A congested lymphatic system does not just affect how your face looks. It can leave you feeling generally more sluggish, since your body is working a little harder to manage fluid and waste that should be moving along more freely. Supporting healthy drainage is one of those quiet habits that tends to support how you feel overall, not just how you look in the mirror. So here is what I want you to take away from all of this. Your face is not separate from the rest of your body. It is connected by a real, physical drainage system that responds to gentle, consistent care. You do not need expensive treatments or complicated routines. You need 90 seconds, a little knowledge about which direction to move, and the patience to do it daily. You now know something most people never learn, simply because nobody ever explained it to them this clearly. You know why mornings are harder on your face than evenings. You know why pressing directly on puffy areas without clearing the drainage point first rarely works. And you know exactly how to fix it, starting tomorrow morning, in less time than it takes to choose what to wear. If this helped you understand your own face a little better, do something kind with it. Send it to someone you love, a parent, a sibling, a friend who always says they feel puffy and tired in the mornings and never knew why. This is not a sales pitch. It is just useful information passed from one person who cares to another. If you want more of these clear, practical explanations of how your body actually works, subscribe, because next time we are going to talk about a habit happening in most people's kitchens every single evening that quietly affects how well they sleep, and almost nobody connects the two. Take care of that face of yours. It has been working hard for you longer than you realize.